Hello, this is Dr. Brian McDonough, and welcome to another edition of the Dr. Brian McDonough Show. I'm very happy to have with me Dr. Adam Metwalli. He is a professor of urology at Thomas Jefferson University and Hospital, and he's going to talk about prostate cancer. But what is really exciting is really a relatively new approach, focal therapy for prostate cancer. First of all, Dr. Metwalli, thanks for joining us.
Thanks for having me, Brian. I really appreciate it.
So overall, just in general, how big of an issue is prostate cancer?
Well, it's actually a huge issue. It's the second leading cause of cancer death among men, and it's the most commonly diagnosed cancer in men. So there's a significant disease burden, not only in the United States, but internationally. So it's a significant problem.
Now, when we talk about focal therapy for prostate cancer, what is that?
Well, historically, the treatments for prostate cancer have been radical prostatectomy, which is the entire removal of the prostate, or radiation, which can be delivered externally with external beam radiation, or brachytherapy, which are radioactive seeds that treats the whole entire prostate. Both of these treatments are very effective at treating prostate cancer, but they come with some side effects. And, the prostate, for those who don't know, is an organ that's intimately involved in sexual function and urinary control. And so there can be some negative effects of whole gland treatment on those factors, which are significant quality of life, factors that people that can really diminish your quality of life as you age if they're impaired.
So the idea of doing focal therapy, I guess, or directed therapy, it reduces the chances of those things from occurring?
That's the idea. So, historically, we always thought that if you found a small focus of prostate cancer in the prostate, that it would eventually grow into a life-threatening cancer. And so we needed to be very aggressive to remove the entire area where, the prostate cancer could develop or spread. What we found out over the last 30 years or so is that the natural history of prostate cancer is actually, it's a much slower growing disease, and it comes in a couple of different flavors, some of which don't grow very fast and can be watched safely for years and years and years. And so focal therapy is an outshoot of that, where if you find prostate cancer in the prostate and it's relatively low grade, and we would ordinarily watch it, but there's one area that might have slightly higher grade disease that we think might need to be treated. Do we really need to remove the entire prostate, or do we need to radiate the entire prostate just to address that one area? And so focal therapy has arisen out of that. And if we just treat that one area and then watch the rest of the prostate using MRI and repeat biopsies, perhaps we can avoid the toxicity and morbidity of whole gland treatment. We've been using cryotherapy, which is basically creating freezing temperatures in certain areas of the prostate to destroy the tissue that way. And we're about to start a HIFU program. HIFU is an acronym, stands for High Intensity Focused Ultrasound. I think most people are familiar with ultrasounds, which are really benign imaging techniques where you put the jelly on the skin and wave a wand over it and get images of what's going on inside the body. But if you take those ultrasound waves and focus them at a high intensity, it can create heat, basically, that will cause the proteins in the cells to denature, and it kills the cancers that way. And we can focus it very precisely. The equipment that we have allows us to take the images from the MRIs, which show where the cancer is in the prostate, and map it out in real time so that we can just target that area and spare the rest of the prostate, including the nerves that sit on either side of the prostate that help with erections and avoid the bladder neck, which helps with urinary continence.
Dr. Metwalli, anyone who's watching can tell you're obviously in the operating room. I know you're very busy. Is there anything I didn't ask you that you wanted to bring up or add to this that you'd like to talk about?
Yeah, absolutely. I mean, I think focal therapy has a really, really bright future in urology. I'm not sure that the energy source is absolutely the most important thing. I think it depends on where the lesion in the prostate is. I think some energy sources are better for certain areas than others. And not everybody's going to be a candidate for focal therapy. But we're looking forward to um, getting this out, outreach into the community, and spreading the word that for very selected men who have, relatively small focuses of intermediate grade cancer, this may be an alternative to the whole gland treatments like radiation and radical surgery.
Dr. Adam Metwalli, I want to thank you for joining me on the Dr. Brian McDonough Show. It's been great to have you on board and really appreciate you sharing your time.
It's my pleasure and it's a privilege, and I thank you very much